And to all of you joining us here today, our elected officials who I just had meetings with, thank you for joining a conversation about something that maybe it takes the first mom governor to understand how critically and important it is for moms and babies to have a healthy pregnancy and birth. Right. And it's something that other communities can take for granted, but there are others, like the Bronx, which has the highest mortality rate overall, but highest infant and maternal mortality rate of the other boroughs, 9 times more likely to die in childbirth if you're a woman of color. I mean, you can't talk about these and hear about this and not feel compelled to take action immediately. So we have worked hard on this issue. I have prioritized it. I've talked about in my State of the Union address, elevating this crisis which has unfolded. And we have worked hard to find strategies. And we just had a wonderful tour with Mari Millett, the president and CEO of the Morris Heights Health Center. I want to thank you and your really passionate team. You know, the head of OBGYN we just took a tour with and walked and saw the people that are so committed, you know, to support people like you. I want to thank you for all you do, doing such tremendous work. And I just want to say, sometimes it's about the people that matter. Sometimes a little extra money matters and can help. And so I also want to announce, while you're sitting here, to close the gap you need to expand the Morris Heights Health Center and bring back the services, $8 million for you today. I will say, Assembly Member Udelka Tapia, even when I'm marching with her in the Puerto Rican parade, all she kept talking about was the need to get this done. So she's been passionate, Councilmember Sanchez as well. Your advocacy has been powerful, but just going there today, I said, no, we need to do this. We need to get this funded, and I want to thank you for all you've done. We'll build a maternal health center of excellence. I want others to look at what we do here as the model of how we protect moms and babies and give them world-class health care that they deserve. So thank you. And we're going to continue. And here's to help, we got another proclamation here. This is, and I'll sign this too because why not? This is a standing order for our second announcement that is being actually issued by the Commissioner of Health today. And what this does is it says it now expands. I announced this, but we had to do this officially. Now expands doula services by allowing people to use Medicaid dollars to pay for these services. Women on Medicaid. They don't need a referral anymore. They don't have to worry about the cost. That doula services, which have really stepped up into the forefront as a service that is indispensable for women to make sure that they have an advocate when they go to their appointments and ultimately child. There's someone who understands, it's culturally competent, there's people who understand the stresses, and someone who's been through it themselves often. So I'm going to sign this here right now and make this real official and say that going forward we're going to make sure that we are doing everything we can. And lastly, I want to talk about something that, as someone who had my own babies and had the luxury of being able to leave work to go for doctor's appointments, there are many women who do not have that. If you're minimum wage or working hourly or just any time off work means less money for you, that is an injustice. So we'll be the first state in the nation to allow for 20 hours of paid prenatal care so our moms can get to the appointments, and that is now official as well. So